Some other indications for obtaining a blood gas sample would be cyanosis or shortness of breath, or if you're trying to diagnose a respiratory problem. Some contraindications would be if the patient is on any anticoagulants, if the patient has any arterial shunts or grafts. At that point, you would also check the patient's FiO2 settings, how long they've been on those settings or been on that device. At that point, you can go ahead and gather your equipment. So you would need a heparinized needle, you would need a biohazard bag, you would need requisition slip, you would need your gauze, air bubble cap, iodine and alcohol prep pads, and a bandage. Once you have gathered all your equipment, you would fill out your requisition slip. So you would put the patient's name, last name, date of birth, patient's temperature, the room number, the date, the time, and the type of test you are performing, and FiO2 settings and devices the patient is using. You want to make sure that the patient has been on these settings for at least 30 minutes before performing the procedure. At that point, I'll perform hand hygiene before entering the room. I would introduce myself. Hi, my name is Miranda. I'm a respiratory student, and today I'm going to be gathering a blood gas sample from you. And I would explain to the patient the procedure. I would also explain some risks that could be involved. So I would explain possibly pain, possible infection, possible nerve damage or arterial scissoring. I'll make sure the patient understands the procedure, and then I would proceed. Next, I would choose which arm I would want to do my blood gas on. So for this patient, I've chosen the left arm. Again, some contraindications which I would not want to do a blood gas sample on would be if the patient has any arterial shunts or grafts. A good indication to know if you should not use that arm is if the patient, if you cannot perform a blood pressure on that patient. At that point, you would choose another arm or another site to do the ABG. At that point, you would feel for the patient's pulse. You would do an ounce test. So the way an ounce test is performed is you cover both the ulnar and the radial pulse, and you would ask the patient to open and close their hands, and you would want the blood to go away from the hand into the arm, and the palm should be turning white. And once you release the ulnar artery, then blood should be rushing back into the palm, and it should turn red within 5 seconds. That would indicate a positive ounce test. If your patient is unconscious or unable to follow directions, then you would again cover the ulnar and the radial pulse, and then you would, with your thumbs, push the blood away from the hand towards the body until the palm turns white. Again, release the ulnar artery, and the blood should be rushing back into the palm, and it should turn red within 5 seconds. Once you have a positive ounce test and the patient's arm is hyperextended, you would go in with a 45-degree angle. Or if you're using a brachial artery, it would be a 60-degree angle. A femoral artery would be a 90-degree angle. You would then feel the pulse with your fingers, and at that point, before you start your blood gas sample, you would put your gloves on. And a good idea, or a good tip would be to use a glove size smaller, because that will help you to get a better feel for the artery. So at this point, you can go ahead and start cleaning your site. You would get the iodine packet, you would clean the site, and you would rotate around it until you are 2 inches away from the site. And it would be a good idea to clean the fingers that you are going to be using to fill. So clean the tips of your fingers. And then again with the alcohol prep pad, do the same procedure. Start from the site, rotate around it until you are 2 inches away from the site. Ask the patient if it's okay if you place the gauze upon their arm. That way it's ready to be able to use and apply pressure. Then you would get your heparinized needle. And you want 1 cc of blood, so you would make sure that it's at 1 cc. You would make sure the bevel is pointing up and that the cap is pointing away from you to not obstruct your view. You would go in within a 45-degree angle. And at this point, your bubble cap is ready. And I would place it right here. And my biohazard bag is ready. I can remove the cap and feel for the pulse, and then go ahead and stick the needle in. If you have hit an arterial artery, then you should see a flash of blood, of bright red blood. Then you apply pressure to the site. You would cap the needle away from you. At this point, you can remove the needle. And go ahead and cap your sample. To remove air bubbles, you would tap on the syringe and can apply a little bit of pressure to remove any bubbles. Then you would put your sample, or before that, you would shake your sample while applying pressure. And this is to mix the heparin with the blood together. You would want to put pressure on the site for at least 5 minutes or until the bleeding has stopped. At this point, you may toss the gauze and place your sample along with the requisition slip into the biohazard bag. Then you can toss the needle into the sharps container, clean the area, dispose of any of the equipment that you used, and remove bloods. Then you would want to perform your analysis of your ABG within 5 or 15 minutes. If you are not going to analyze it within 15 minutes, then it needs to go in the ice slush. And this is to prevent metabolization of the blood. And if you do not perform it within 15 minutes of being in the ice slush, then you cannot go past an hour. If it goes past an hour, you would need to resample your test. Then you would analyze the sample, and you would report your findings to the clinician that's requesting the results. You would also make a modified plan according to the patient's needs. Then you would go ahead and chart these findings. 3 alternative devices that you can use instead of a blood gas would be a transcutaneous blood gas monitor. You can also use pulse oximetry, or you can use capnography. The variation in sample size would be according to the blood gas monitor's needs, it may require more or less than 1 cc. Also, when you're performing the test, if a fellow clinician may need blood, it may be a good idea to get more instead of having to have them prick the patient again. So those are the situations that you may need more or less blood from the patient. Too much heparin in the blood gas sample could also affect the results of the blood gas. It could dilute the sample, which could increase the CO2, or it would decrease the CO2 and increase the pH, giving a false reading. For complications that may occur with obtaining a blood gas sample is pain, hemorrhages, arterial scissoring, arterial spasms. Again, it's a good idea to wait at least 30 minutes, or to make sure the patient is on their FiO2 or their oxygen device for at least 30 minutes to get an accurate blood gas result. And that's it.